My name is Dr. Moira Stilwell, and before I was elected 2 years ago, I've spent 32 years practicing medicine and advocating for children's and women's health issues. One of the reasons that I decided to run is I wanted to make more of a difference on matters about which I care deeply. When it comes to health, there are 3 subjects that we need to engage in dialogue and change. The first challenge is correcting the shortage of healthcare professionals. The second is altering how we manage chronic disease in primary care. And the third is private health care. I believe that some of the shortages of professional healthcare workers, including physicians, are artificial. We've created a shortage of physicians practicing what we need, where we need in British Columbia because of restrictive policies. Unfortunately, that includes keeping British Columbians who are studying medicine abroad from returning to British Columbia to complete their residency and practice here. Because the rural communities, and indeed many communities, are desperate for physicians, some element of change is required. The same can be said for our healthcare system. We are very good at some very important things, for example, acute care, cancer treatment, and heart disease. But when it comes to things like chronic disease management and primary care, there's just not enough system in our healthcare system, and it becomes a do-it-yourself operation. We need to make sure that patients can be their own best advocates, and we create more integration and collaboration between healthcare professionals and health services. Lastly, we need to recognize that private healthcare exists, is probably here to stay, and has a role to play. By shying away from an open discussion of the role of private healthcare, we end up accepting a form of private care that's not the best suited to our tax-funded public system. When something goes wrong in the private care system, the public system ends up picking up the cost. At the same time, there is a court decision that says private care is here to stay. We need to have an open discussion about how to find the best private care to make sure that everyone can have the high-quality care they need when they need it, regardless of their ability to pay. So please join me in an open discussion of how we can have a healthcare system that provides high-quality access to top-quality care to everyone when they need it.